If you're watching this and you're pregnant, I'm willing to bet one of your number one fears about childbirth is tearing down below, and with good reason, because that hurts. So I am here to give you 7 methods to reduce perineal tearing in childbirth. My name is Tina B. I am a labor and delivery nurse, so I've seen my fair share of perineal tears, but I'm also a mom of 4, so I totally understand the want to reduce perineal tears if we are able to. But before we get into how we can do it, let's first understand what is a perineum and what do we mean when we say perineal tears. So for our anatomy, if this is your vagina and then this is your bum and your bum hole down here, this area of skin that connects your vagina to your bum hole, that is your perineum. And if you tear it, there are 4 possible degrees that tear might be. In a first degree perineal tear, that is tearing of the skin around that vaginal opening. When you move into a second degree tear, you're now talking about the skin being torn, but also the tissue and muscle behind that skin. And a third degree tear, now we're getting into the more severe tears. This is tearing of the skin of the perineum, the muscle and tissue of the perineum, but also it extends into the muscle surrounding the anus. And then a 4th degree tear, which is the most severe tear, that is going to be tearing of the skin, the muscle surrounding the anus, but also extending into the tissues surrounding the anus. You are going to be more likely to experience this if it is your first vaginal delivery, if your baby is a little bit larger, somewhere around 9 pounds or more, if your pushing phase of labor is very, very long, if your baby has a shoulder dystocia or their shoulder is getting stuck up under your pelvic bone, or if you have an assisted vaginal delivery, which means having a baby with the assistance of a vacuum applied or forceps applied. Let's try to avoid all that. Method number 1, warm compresses. This is a really, really simple technique, but it has been shown to decrease your rates of 3rd and 4th degree tears, but also decrease your chances of having an episiotomy. And all that is involved is having your support person or a doula or even your provider take a face cloth, wet it under nice warm water, and apply that warm compress to your perineal skin while you're pushing. Now, you're welcome to put it on before you're pushing if it feels good to you, but this is going to be most effective done while you are pushing your baby out. And by keeping that perineal skin moist and warm, it is more able to stretch to accommodate baby's head. And this is the same reason why water births are also shown to decrease rates of tearing, because when you are in that warm water with pushing, it is keeping that perineal skin nice and warm and moist and pliable. Method number 2, laboring down. What this means is you're going to get to fully dilated, but you're not immediately going to start actively, forcefully pushing baby down and out. Instead, you are going to allow your uterus to passively start lowering baby into your pelvis a little bit lower and into your vaginal canal. And in doing so, baby's head is going to slowly stretch out those tissues of your perineum, getting them ready for crowning and birth. Now, this can be done as long as baby's heart rate is happy with it, because sometimes when you get to fully dilated, your baby wants to come out sooner rather than later. But if you are coping with the pain and pressure and your baby's heart rate is happy, then laboring down is a really great option to try to reduce those tears. Method number 3, avoiding an episiotomy if you are able to. Some studies have shown that episiotomies, they actually increase your rates of severe tears by up to 22 times. 22 times. That is a big number, and let me tell you why. When we're doing an episiotomy, what's happening is you are taking scissors and you are cutting the skin of the vaginal opening to make it larger for immediate delivery of baby's head. And when you take scissors and you make a cut, then the tear is able to then take the path of least resistance and carry on the same direction as that initial cut is made. So it's very easy for an episiotomy to extend into a severe tear. Method number 4, birthing your baby in different positions. Did you know that laying flat on your back and having your baby that way has the highest risk of perineal tears? And not only perineal tears, it has the highest rates of episiotomy. And yet, this is still the most common position we see people delivering their babies in, especially in the hospital setting. And if you were to get into a more upright position when you are pushing and birthing your baby, not only do we reduce your overall risk of perineal tears, but you also reduce your risk of having an instrumental vaginal delivery, meaning you're reducing your risk of having vacuum or forceps applied to your baby to assist you in delivery. And as we talked about earlier in the video, we know that these instrumental vaginal deliveries, they have a risk of perineal tears all on their own. Some of the best positions to try to get into to reduce your risk of perineal tears are going to be things like supported kneeling or all fours or even side lying. Basically anything but flat on your back with your legs in the stirrups. Method number 5, this one's easier said than done, a slow controlled birth of baby's head. There is always a point in time where you'll likely hear your provider say to you, stop pushing, or push softly, or pant or grunt, or whatever you need to do so that you don't push with full force at a certain point in time where you're delivering the baby's head out of your vaginal opening. And that is because if you push baby's head down onto your vaginal opening with really, really hard force, you're going to increase your risk of perineal tears. Method number 6, open glottis pushing. What? Okay, there is closed glottis pushing and there's open glottis pushing. When I was instructed on how to teach people how to breathe and to push, I was instructed to tell them to closed glottis push. And what that means is you take a deep breath in, you hold it all up top, you make no noise, hold it up, and then you push down. And you feel like your face is going to explode and your eyes might just pop out of your skull. Now that sounds really, really terrible, but it does have a function, and the function is you are going to get a more forceful push when you do closed glottis pushing. And we might utilize that if baby is in trouble and their heartbeat is down, we want to get them out faster. However, when we're talking about reducing perineal tears, something called open glottis pushing is likely going to be more beneficial. When you do open glottis pushing, you are doing the same downward pushing force right out your bottom half, but instead of taking a big deep breath in and holding your breath making no sound, you are going to take a deep breath in, and as you are pushing down, you're going to do a slow exhale, or you can whisper talk, or you can grunt or moan, whatever noise you need to make. But the key here is that you are letting air slowly exhale from your lips. So you take that same big deep breath in, and then as you're pushing down, talk to your partner. Either way, you are still pushing down, but you are letting air out. So the push is more consistent, it is less forceful, and it is going to be gentler on your perineum. Open glottis pushing is also good for if you are feeling overly exhausted. It is a better way to push. It's not going to tire you out as much. And a lot of people report that open glottis pushing just makes them feel overall less anxious. If you're wanting to use open glottis pushing when you have your baby, it's a really good idea to practice this skill before you actually go into labor. So when you need to utilize it, you are really, really comfortable with it. And the best time to practice it is when you're having a poop. I know so many things I talk about have to do with poop, but it's a really, really good scenario to practice because you do need to do the bearing down so you can practice taking a big deep breath in, slowly exhaling as you're trying to have your poop. And let's be real, you're actually going to poop a lot of times leading up to your delivery, so you'll have lots of chances to practice. And our last method, method number 7, is perineal massage. Now, the idea behind perineal massage is you're getting those perineal tissues ready before your baby's head comes in contact with them. The studies have actually shown that perineal massage in first-time parents can reduce your risk of those severe 3rd and 4th degree tears and also reduce your risk of episiotomies. And people who have already had a baby, you are not lost here. Perineal massage has been shown to decrease pain in your perineal area 3 months postpartum. You can start perineal massage between 34 and 36 weeks of pregnancy, but always check with your provider before starting something new. And you can do it 3 to 5 times a week for, like 3 to 5 minutes each time. And if this is your vagina here, then this is going to be your bum hole down here. Then this is the back wall of the vagina, and this is the area you are targeting with perineal massage. And to do so, you're going to take your 2 thumbs, which are clean, very important, and also lubricated. That's important as well. And you're going to take those thumbs and you're going to insert them down into the back wall of the vagina. And once you're there, you're going to make a U-shaped motion and you're going to apply gentle pulling pressure. Now, perineal massage, it shouldn't hurt. You're not signing up for a torture session. It should just be gentle stretching back and forth. If your first thought is, how am I going to reach around my pregnant belly to access my perineum? Well, you can, for one, ask your partner to help you. They can do it for you. Make sure their hands are clean and lubricated as well. But if that gives you the heebie-jeebies, you're not comfortable with that, there are products on the market that are going to help you out. This is an example of one of them. It's called Perimum. It's basically the same shape as your thumb, but it gives you a nice extended reach. So there are options like that on the market. Now, we talked about lubrication as well. My suggestions would be a natural oil, such as this is a sweet almond oil. You can also use olive oil, that works too. Or you can use a regular lubricant, likely water-based, but you do want to make sure that you are lubricated so you don't cause any injury or soreness in the area. All right, 7 more ideas you can put into your bag of tricks to hopefully reduce your perineal tears at your delivery. If you like this video, go ahead and give it a thumbs up. I had a great time making it for you. Consider subscribing to the community, and I will see you in the next video.